Yes, and I think we've got a lot of listeners who are thinking broadly about what the causes would be. One listener wants to know how likely cyclospora might be. And I think you've addressed that you want to think broadly, and I would suggest to that individual to tune in to our episode on acute diarrhea due to parasitic diseases. So why don't we finish up here?
Okay, so the last question was about hospitalizations, and indeed what factors would suggest hospitalization is appropriate for a child with acute gastroenteritis such as we've presented.
Okay, and I think that all these answers are important ones and suggest that there are a number of factors that you're going to ask about as a clinician. And why don't you see if you have any other comments about these factors that you're looking for.
So again, I think that as we've tried to stress, the hydration status is ultimately the determinant of what intervention strategies need to be brought to bear for the child. The fact that there's persistent vomiting might mean the child should be hospitalized, but it might mean that a dose of ondansetron could be given and oral rehydration strategies tried for several hours at home to see if they would be effective. The fact that it's a high-risk infant should indeed make the communication between the parent and the physician more frequent, but by itself might not require the child to be hospitalized. But I think here, systemic signs such as a change in mental status would definitely warrant the child being seen and potentially hospitalized if indeed that is confirmed by a clinician.
One listener would like to know whether there are any age restrictions on the use of ondansetron.
I believe when I read the WHO report, it was for children over, I have to go back, whether it's 3 months or 6 months of age, that they were comfortable using it. I'll check that and let you know so you can let the audience know.
All right. And one listener has a question about pets. They mentioned that their pet has had diarrhea for a long period of time and that their vet mentioned that some organisms can cross species. Can you comment on this at all?
Well, the pets can be a source of infection for children. Oftentimes it's more likely from scratching and biting than it is from a gastrointestinal illness in the pets. But I do believe there are some gastrointestinal pathogens in pets that may be found in children, but it's not a common source that I see, at least in our population at the hospital. We see pets more from, as I've pointed out, biting and scratching than we do from a gastrointestinal point of view as the source of infection for children.
Okay, thanks.
So let me summarize, and then if there are some additional questions, we can go to that. Viral gastroenteritis remains an important cause of ER visits and hospitalizations for children less than 5. Viruses can often be suspected from the clinical, epidemiologic, and stool characteristics that we will either observe or get as part of our history. That indeed rotavirus and norovirus are the two most common pathogens in the pediatric population, and each has a slightly different epidemiology, but there's plenty of overlap with daycare center being a primary site for both of these. That prevention with vaccine and interruption of transmission are critical for preventing outbreaks, and I think I've identified the use of rotavirus vaccines, the precautions or contraindications, as well as strategies to help interrupt transmission, both for use in the household as well as for you to advise daycare centers on. And then the treatment is basically symptomatic, and oral rehydration therapy has really replaced hospitalization and IV rehydration for many children and is very effective. Yet there will still be the occasional child or a few children who will need hospitalization because either they're a vulnerable child or indeed disease has progressed so rapidly that it's impacted on their hydration status that they need intravenous replacement. Thank you.
Thank you very much, Steve. That was terrific. Just a couple more questions, and a couple of listeners are sending in comments regarding ondansetron and saying that in their personal experience it has been very helpful and can prevent the child from having to make a visit to their office or to the hospital. And one listener writes in saying that some of the other listeners may recognize the drug by the brand name Zofran. We've been trying to use generic names, but other listeners may also recognize that more. And then one last question. One listener points out whether when we mentioned the use of ethanol for cleaning, did we mean isopropyl alcohol or were we referring to ethanol? And do you have any comment about that at this point?
Well, I can tell you that the Red Book specifically identifies ethanol and not isopropyl alcohol. I would again have to look to be sure whether isopropyl alcohol in the common formulation that we see it is as adequate or not. Unless you know the answer, I'm gonna...
Nope, I don't know any more than what you've just mentioned.
So we're gonna go back and look that question up. It's a terrific question. I'm reminded of a colleague who once told me when somebody asked him a question from the audience that his answer was, "We didn't get that question in the rehearsal."